Let us read about potential complications after intestinal surgery. There are 8 types of complications. We will see one by one and its interventions. First one is paralytic ileus. Intervention will be initiate or continue nasogastric intubation as prescribed. Prepare patient for X-ray study. Ensure adequate fluid and electrolyte replacement. Administer prescribed antibiotics if patient has symptoms of peritonitis. Second one, mechanical obstruction, and the intervention will be assess patient for intermittent colicky pain, nausea and vomiting. Intra-abdominal septic conditions. Under this peritonitis, intervention will be evaluate patient for nausea, hiccups, chills, spiking fever, tachycardia. Administer antibiotics as prescribed. Prepare patient for drainage procedure. Administer parenteral fluid and electrolyte therapy as prescribed. Prepare patient for surgery if condition deteriorates. Abscess formation. Administer antibiotics as prescribed. Apply warm compress as prescribed. Prepare for surgical drainage. Surgical wound complications. Under this, infection, wound disruption, intraperitoneal infection and abdominal wound infection. First one, infection. Monitor temperature, report temperature elevation, observe for redness, tenderness and pain around the wound, assist in establishing local drainage, obtain specimen of drainage material for culture and sensitivity studies. Wound disruption. Observe for sudden appearance of profuse serous drainage from wound. Cover wound area with sterile towels held in place with binder. Prepare patient immediately for surgery. And the third one, intraperitoneal infection and abdominal wound infection. Monitor for evidence of constant or generalized abdominal pain, rapid pulse and elevation of temperature. Prepare for tube decompression of bowel. Administer fluids and electrolytes by IV route as prescribed. Administer antibiotics as prescribed. Under third heading, anastomotic complications. Under this we have two dehiscence of anastomosis and fistulas. Dehiscence of anastomosis, prepare patient for surgery. For fistulas, assist in bowel decompression, administer parenteral fluid as prescribed to correct fluid and electrolyte deficits. So complications, 8 complications: paralytic ileus, mechanical obstruction, peritonitis, abscess formation, infection, wound disruption, intraperitoneal infection and abdominal wound infection, dehiscence of anastomosis and fistulas. Thank you.